Hi everyone, this is Dr. Virginia Ellis over here at Virginia H. Ellis DDS Dental Corp. Today, I am going to be answering questions about Invisalign. A lot of you have been asking questions, so we're going to take care of this topic for you. I got my list of questions over here, so let's get started. Okay. Dr. Ellis, what is Invisalign? Basically, Invisalign is an alternative option to doing braces to straighten your teeth. So as you may have seen, the traditional route was to do the train tracks, the metal braces. A lot of people don't like the way that looks, and sometimes it's uncomfortable when the wires are being placed in your mouth. So the other option that has come back or come into the market has been the use of bleach-like looking trees that you wear for a long time in the day. And that also helps straightening out your teeth. So it's an option to straighten out your teeth as an alternative to using the traditional train track metal braces, okay? All right, how does Invisalign compare to traditional braces? Well, everyone, basically, they both straighten out the teeth, okay? But how the system works is different. The Invisalign uses clear trays that you wear in most of the day, and you have the option to take them on and off when you eat and when you're brushing your teeth. So it's a lot easier to brush your teeth and floss your teeth. When you have the traditional metal brackets that I call the train tracks, okay, it's harder to clean your teeth. Okay, it takes about 20 minutes to clean your teeth if you're really fast, usually about half hour, okay, to floss your teeth and brush your teeth. Your cheeks get really sore with metal braces, but it has to be the right option for you. There's pros and cons about these two systems, and we'll be answering some more questions about that, okay? All right, so basically, Invisalign is just clear trees. The brackets is just the metal, brackets that you get on your teeth that have the wire. Metal brackets tend to be more uncomfortable than the Invisalign. Invisalign you can take on and off. It's a lot easier to clean your teeth. The braces, they work. They're really good for people who have trouble with trays. Okay, so the Invisaligns are not for everybody, as are the train tracks, the metal brackets. Okay, is Invisalign really faster than braces? Well, you know what? That depends on what your particular situation is. So you can't take this Invisalign system and think that it's better and that it'll work faster. It depends, because metal brackets can also do the same thing, okay? It just depends on your system. You can't really judge it just because you think it's a simple case. What you really do have to do is go to your dentist and have us evaluate, okay? Have the orthodontist or have the dentist who practices Invisalign evaluate your teeth and let you know what an estimate would be. Again, remember, this is an estimate. Don't ever think that when you're going to the orthodontist, the specialist that does braces, or the other dentist, the general dentist that also do Invisalign, that, oh yeah, it'll be about 18 months, 12 months, or whatever. Don't just go right by that, because every case is different and everyone responds to treatment differently, okay? That's just the nature of healthcare, right? Just keep that in mind. Never hold people to those months, because that's not how it works. Every case is different, and every person reacts different to the shifting and the movement of teeth. There are several factors that depend how fast your treatment will be, okay? Why is Invisalign considered more comfortable than braces? And for the reason I just stated priorly, it's more comfortable in the sense that it's easier to brush your teeth and floss your teeth with Invisalign. Braces, it takes a lot. I actually had braces, okay, in my 30s. So, I like the results I got. I got the metal train tracks, but they were uncomfortable. It just depends, right? Sometimes your cheeks get really sore as the wire moves, or they tighten it, your teeth get sore. But that's not to say that Invisalign doesn't make you sore. It does. I mean, it's just trace. It's different. The other thing people don't talk about that I see a lot of people get concerned from time to time is when you have the traditional braces, your teeth are held in place. They get really loose, right? Really mobile. You don't notice it when you have your braces because the wires are holding everything together. But when you have the aligners, especially the women, the moms, they get concerned. Oh my gosh, my teeth are so loose. Well, it's because your teeth are shifting. They have to move, right? So putting in, putting out, you do see the difference of how loose your teeth get, but they have to be loose in order to move, okay? So they're more comfortable in the sense that your cheeks and your tongue are not constantly getting sore or scratched by the brackets. The wires are not poking out. But having said that, Invisalign is made for people who can tolerate trays in their mouth all day long, okay? So just think about that. If you're the kind of person that can tolerate having trays in your mouth all day long, and you know you're going to wear them all day long, then that's an option for you. And also remember, when we put the Invisalign trays, they're not just putting the trays, they're also sometimes putting like plastic or resin buttons. They call them buttons, but sometimes they feel like spikes, okay, to anchor the clear aligners or clear trays into your mouth. So it's not like they're just all smooth. No, because they do have to put, hook-like plastic or resin attachments that are glued to your teeth. So just think about that, okay? If you cannot wear trays in your mouth 20 to 22 hours a day, it's not an option for you, okay? I have had people who've been on Invisalign forever because they don't wear the trays every day. So if you know you're that kind of person, don't opt for Invisalign, opt for the braces. If you know that you don't like the braces, or you know you're going to be really good with wearing your trays, it's called being compliant, then opt for the Invisalign. But again, each case is different. Go over it with your dentist to see what is going to make most sense to you and what your particular situation is going to work well with, okay? So not every case is an Invisalign option, okay? How long does Invisalign take to straighten my teeth? Again, that depends. If you have really crooked teeth, it'll take longer. If you have just a simple case, it'll take shorter. On average now, it usually takes anywhere, now this is an average, 12 to 18 months. So you could say like a year and a half for a lot of people, but it can be shorter or it could be longer depending on your particular situation. That's why you are encouraged to, or you have to actually have a consultation. That's the purpose of a consultation. What is the process involved in Invisalign treatment? Okay, the process involved in Invisalign treatment is basically you go in for a consultation. Usually you'll discuss with the doctor what you'd like. The doctor will look at your teeth. They'll decide whether or not your particular situation is a realistic situation where you can straighten your teeth with Invisalign aligners or retainers. And after that, they'll take x-rays. They'll do a lot of studying and measuring and looking at x-rays and looking at your mouth. And then they'll come back and tell you with an estimate of how much they think it'll cost, about how long it'll take, okay? And then they scan your teeth, and then I'll go ahead and give you the trays, okay? As I said before, they don't just give you the trays. Sometimes they have to put resin buttons. They have to bond resin to attach the aligners. A lot of times they're not just things you just put in your mouth. It just depends. Sometimes they have to anchor and pull a part of the tray to contact your teeth in certain ways. So just remember, you're not just putting in the aligners. You also have some plastic buttons that may be uncomfortable to you when you take out the trays. But if you're wearing the trays 20 to 22 hours a day on average, okay, then it doesn't really make a difference except when you're taking them out to eat or brushing your teeth and flossing, of course. Okay, what are Invisalign trays and how many will I need? Okay, Invisalign trays are just thicker than bleaching trays, or more rigid, of course, because they have to shift teeth or move teeth. And on average, this is average now, most cases tend to use about 20 trays, okay? And you go through one set, wear them for a temporary amount of time, couple weeks, and then move on to the next set once your teeth have shifted, okay? So it's a gradual progression of the using from tray 1 to tray 20. But again, it really depends on your case. Some people need more trays, some people need less trays, and that'll be decided once you have your consultation. And sometimes during the consultation, as treatment is progressing, they may rescan your teeth and reduce certain trays to accommodate for your particular needs that you'll need to straighten your teeth. Is there anything that could disqualify me from using Invisalign? Well, I would say the number one thing is if you know you're not good with having trays in your mouth, that's not a case for you, right? That's not an option for you. That's what I personally did. I used to train tracks because I knew I wasn't going to be good with holding the trays in my mouth, putting them on 20 to 22 hours a day. So that's kind of hard. And sometimes, if you have an advanced case where your teeth are really crooked, the most predictable and reliable way of straightening teeth is still the train track. I call it the train track method. The brackets, the metal braces, those are more predictable. And what I mean by predictable is they usually place the metal buttons, so the brackets on your teeth, and then bend wires a certain way and tighten them a certain way with certain tension, with the thought, if I do this, the teeth are likely going to move this much. But it's always about, they'll likely move this. If I do this with the tray, I will get this result. If I do this with these wires, I will get this result. So it's always an estimation. The metal brackets are generally more predictable than the Invisalign. It just depends, okay? You have to be patient. Don't just try to get your braces off right away. Try to go as fast as you can, because you really have to work with the way your body is responding to the Invisalign trays or with the metal brackets, okay? Do I sleep with Invisalign? Yes, you do. Again, you have to wear those on average about 18 to 22 hours a day. I may have said 18 to 20, but really, realistically speaking, if you wear them for like 22 hours a day, I think that'll be the best results for you. The more you wear them, the more predictable the changes for you, and the faster as well. Okay, is there anything that could disqualify? Yes, we already talked about that. Not being able to tolerate using the aligners and being able to keep them on most of the day, 18 to 22 hours a day on average. Or if your case is just so advanced, so crooked, your teeth are really crooked, or you have a jaw issue, skeletal, a cranial issue, then that is not going to be an option. You may need more than just Invisalign trays, like surgery, or sometimes a combination of metal train tracks, or the brackets, and the Invisalign, okay? Can Invisalign fix crossbite? A lot of times, no, because usually it can. But in a very simple case, a lot of times that happens. A crossbite, some people don't know what a crossbite. If you look at my teeth here, they're straight. And some people, the bottom and the upper teeth don't line up straight. They kind of cross over. And usually that is a result of an asymmetrical and uneven growth of the jawbone, either in the palate or in the jaw. Sometimes the jaw may not be even. It might be like skewed over like that. And that'll cause, the lower teeth to kind of cross over underneath the upper teeth, or the upper teeth to kind of cross over the lower teeth. Okay, is Invisalign painful? It is sometimes painful when your teeth are shifting and you have pressure. You're going to feel the pressure, and it is going to be a little bit uncomfortable. It's not like, oh my gosh, I'm dying here, it's awful. No, it hurts to be beautiful. So if you want to work on, working on the way your teeth are looking, you want to look and, beautify your smile, you are going to have to go through some discomfort. It's kind of like when you go to the gym, right? If you're lifting weights, don't expect not to have sore muscles. When you're improving something and you're changing something, your body has to adapt. And sometimes the adaptation process can be a little uncomfortable, but I wouldn't say that it's just unbearable. But don't go to the dentist thinking that I'm getting Invisalign and I'm not going to feel any discomfort. That is not true, okay? Just expectations are key. All right, does most dental insurance cover the cost of Invisalign? A lot of times dental insurances don't cover braces or Invisalign. Some do. That'll be something you would have to research with the dental practice that you're working with to get your braces. They will have to research that for you, or you may have to go ahead and do that research with your insurance company. Does Medicaid cover Invisalign? The answer is no. Medicaid is usually basically no, okay, unless there's something I don't know out there. But as far as I know, Medicaid only covers the basic necessities, okay? Sometimes in surgical cases, some private insurances can cover braces. They may not cover Invisaligns, but usually the answer is no. Medicaid is designed for very basic needs, not for braces. Straightening teeth a lot of times is considered, not always, is considered optional cosmetic work, okay? It's called optional work, okay? Optional choices, okay? How much does Invisalign cost without dental insurance? Well, the average price, it is June 2024, so on average, it can be more, it can be less, depending on what city and state you live in, okay? I would say between three, that's really cheap, and $8,000, sometimes it's $10,000. So I would say between $3 and $10,000. It just depends on your particular situation. That's why the best thing to do is to call a dentist or a dental office and get yourself in there to go ahead and have a consultation. The consultation does not bind you. It really is an exploration, meaning to see if Invisalign is an option for you. It's to explore the option of considering the use of Invisalign trays to straighten your teeth. How can I schedule an appointment to talk with a dentist about Invisalign? That's really easy. Call our office, okay? 925-254-4043, okay? 925-254-4043. I usually refer you guys to an orthodontist, and I work with a lot of great orthodontists that can go ahead and take care of your needs and go ahead and answer your questions. Just call our office, okay? I've been answering your questions at Invisalign, but if you have any further additional questions, reach out to our office, come on in, and I'm more than happy to meet with you in person and discuss the further options for Invisalign. Okay, if you're happy with the services or you think you might enjoy sharing this video with someone else, go ahead and share it, subscribe to the channel, and click that like button. I will see you at the next video. Bye.